Yeah, the first big breakthrough that I wanted to talk about today is Inceptor blocking drugs. So first, let's talk about what is an Inceptor. It is a receptor that is produced on the outside of beta cells in response to your beta cells making insulin. And what researchers have found is these inceptors can mess with the appropriate cell signaling in your cells, especially the beta cells. And this can lead to blood sugar dysregulation and lead to decreased sensitivity of your cells to insulin. So, preliminary studies are showing that, okay, you block this inceptor, we are seeing patients have better regulation of the blood sugar. And they're showing that patients have better insulin sensitivity. And this has shown that it can possibly protect the beta cells and protect further insulin sensitivity. So it sounds really great on the surface. And it does sound promising. I think it could possibly be good. But my experience with drugs is okay, this is blocking a certain natural reaction that happens in the body. What are the possible long-term harms, right? So I wouldn't be like one of the first patients taking any of these medications because possibly we see 5 years out that there's all kinds of issues happening that we didn't foresee. Now they do research, they do it for maybe 3 to 6 months of monitoring patients on these drugs, but many times it takes longer than that to actually see the long-term side effects that come from it. So that's my concern because it is blocking a natural production in our bodies. We don't really know the total long term consequences. In the studies before they come on the market, we do know short term, but we never know long term. So I would wait till they've at least been out for 5 years to really know all the side effects that are coming from the medication. So taking an Inceptor blocking drug, would this prevent patients from needing insulin? It can. So that's the good theory that they see here. Okay, you have high blood sugar, you have type 2 diabetes, you're not managing it very well, your cells have decreased sensitivity. So your beta cells start producing a ton of insulin response, right? And that is what leads to the breakdown of the beta cells. It starts getting lazy and saying, hey, I can't keep on doing that. And the beta cells get damaged, and then your body stops making insulin. So you become more like a type 1 diabetic. So you're not making enough insulin over time. So these receptor blocking drugs, based on what they're seeing in preliminary research, can decrease that beta cell destruction and possibly lead to you not having to depend upon insulin in the future. So that's what sounds really cool about with Inceptor blocking drugs is it's able to do that. Question is, what are the long-term side effects in the long run? Could it be great? Yeah, possibly not. So the second one that I wanted to talk about is we have insulin nanotherapy. So it's like an oral insulin nanotherapy that's being done. So you have the insulin in these little microscopic little forms that's able to be absorbed. So right now you can't take oral insulin, you have to do injection. But it looks like they are developing, and in new research that's not totally out on the market yet, a oral insulin. And I'm really excited about this. That if it actually works appropriately and we're able to get blood sugar levels down with using nanotherapy, because when you do an injection, you get a huge flood of insulin. And then you have this high blood sugar, then you have this low blood sugar, high blood sugar, low blood sugar. And it's really hard to get this perfect maintenance. Even with the insulin pumps, they do work pretty well, though. The insulin pumps, especially with AI technology that we have now, that they're always monitoring blood sugar and pumping out insulin as needed. So it's getting a lot better, but it's still an injection and it's a device that you have to have on your stomach all the time. So this insulin nanotherapy technology via oral form sounds really enticing. And I think it would really help balance that blood sugar dysregulation that you see of high and lows. And obviously, you're not going to have to poke yourself all the time. So I think it's going to be a cool technology. Hopefully, they're able to develop it and make it safe for the population. So this third one is really exciting. I love stem cells. It's stem cells that regenerate and heal beta cells, and they're actually encapsulated in a capsule. So very interesting. Right now, at least the technology we have is stem cells up have to be done injection or IV form because they get broken down by your digestive juices. So what they're finding in this research is they're encapsulating it in a way that it's actually able to get into the bloodstream via the oral route through your digestive tract. And also they're like making these special stem cells that are going to focus on just making beta cells, which is very interesting and really cool. And It sounds like a really promising therapy because a lot of patients with type 1 diabetes, their immune systems have attacked the beta cells, and now their beta cells aren't making insulin anymore. And that's why they depend upon insulin. But what we could do is okay, now we can work on the causes of the autoimmunity so the beta cells don't continuously get damaged. And then we could possibly take these beta cell stem cells orally and regenerate that beta cell, and then they don't have to depend on insulin their entire lives. It sounds really cool, but I don't see it working very well if people aren't willing to really treat the cause. Because what's going to happen? You take the pill, which is going to cost a lot of money. I know that. And then you regenerate it, but the immune system's still dysregulated. It's going to just gobble up the beta cell, and then it's not going to do anything in the long run. But if you come into like an integrative doctor like me, we treat the causes of the autoimmunity, calm down their immune system, stop the immune system from attacking the beta cells now, and then we could take these beta cell stem cells. Sounds really promising and cool. So I really hope this comes out soon. So the fourth one I wanted to talk about today is using AI to manage blood sugar. So this is really cool. We're getting a lot more in artificial intelligence, right? Getting a lot more skilled in it, a lot more better technology. We're getting Chat GPT and all that. And we're using that technology in so many different devices. And now they're showing it in the blood sugar devices have AI technology. So you can have constant monitoring of your blood sugar. And then the artificial intelligence is able to tailor things based on what your blood sugar is doing. So it's able to see your dietary regimens, it's able to see your stress responses and see how that affects your blood sugar, right? Your exercise, your diet, your stress, whatever. And then it's able to see, oh, this person actually needs a lot of help. We need to change things up in this patient. But then we see another patient and the AI information that we're getting is like, oh, this patient's well managed. It's really exciting to have this. One concern I do have is the more monitoring we do, the more we freak out about stuff. And everyone has some problems. So I'm not saying that we need to use AI in every tiny little thing in health, because I see like constantly monitoring your blood pressure makes my patients go crazy and anxious, because blood pressure and heart rate are changing all the time just based on your stress response, your exercise response, getting up and down out of your chair or whatever. And they see their heart rate go crazy and then they flip out. So that's the only possible concern I do see with this AI technology coming into medicine is people are going to be too much aware of their health, and that can cause a ton of anxiety and make their health even worse. Yeah, what would I do alongside these medications and other treatments that we talked about today? So I'm an integrative physician. I use both conventional and alternative therapeutics to help my patients to really get the best outcomes, right? So these therapies sound enticing. They are likely going to be good in the future. I do have my concerns with things, right? And I like my patients to wait, not be the guinea pigs on medications. But when we get these out and we've seen good research on them and they've been out a while and we're like, okay, yeah, these are doing exactly what we want to do. What I like to do, maybe we get to a place that we don't have to do like an Inceptor blocking medication, because this sounds like, okay, it's something that you're going to have to be on your entire life. So that medication sounds interesting. Maybe something we start in the beginning to try to increase your insulin sensitivity, but we do a lot of other things on top of that. So like some therapies that I like to do to increase insulin sensitivity that don't make you rely on it or doesn't have really side effects that come along with it is hyperbaric oxygen therapy and red and near infrared light therapy. So there's a lot of interesting research coming out on these techniques on actually improving insulin sensitivity and blood sugar regulation. So it's not just helping modulate blood sugar, it's actually making your cells more have a better reception to the insulin. And then you get all the other side benefits from hyperbaric oxygen and red near infrared light, like mitochondrial stimulation, regeneration, healing, increased brain capacity, think better, anti-aging effects, all that. So you get the blood sugar stuff, but then you get all the other benefits. So those are the therapies I like even more than these Inceptor blocking medications, but they sound promising. And I think there will be a good backup therapy for me when I'm treating my patients. Yeah. So let's dive in. Like, how does hyperbaric oxygen increase insulin sensitivity? One thing that we're seeing in the research is when you're doing hyperbaric oxygen, it helps management of blood sugar. So it decreases blood sugar levels. And this is working by increasing cellular function of all your cells. So it's improving your beta cell function. It's improving your glucagon function in your pancreas. It's improving your digestion of sugars. It's improving how your cells function and work and how they receive messages throughout your entire body. So what hyperbaric oxygen does is it's down to the cellular level, is it's improving oxygen delivery inside your cells and improving the electron transport chain, which is the last step in mitochondrial energy production. It's making that work better. So it's making every cell throughout your entire body work better. And what we see when we improve the cellular function throughout your body, we're improving that membrane in those receptors on the outside. And what we're seeing over time is actually that is then improving your body's ability to actually be more receptive to the insulin when it actually attaches. So your beta cells are able to produce it better, and it's able to go and attach itself to your cells, and your cells are actually able to take it in more readily when we do hyperbaric oxygen. And red near infrared light works in the similar way. It works on your mitochondria, but it works on certain complexes on the out on your electron transport chain too. Different than just supplying the oxygen, is actually helping those complexes work appropriately for you able to go through the steps that you need to make ATP in the end. So that's improving all cells throughout your body too. So that's why both these therapies work so well. So let's talk about like what I'm talking about, red near infrared light. So when we do red near infrared light, it needs to be systemic, right? All your cells have decreased sensitivity to insulin. So you need to do a bed is what it is. It's kind of like a tanning bed, but it's not. It doesn't have any ultraviolet light. It has red near infrared light. You also want to make sure that you're going into a high powered unit bed. There's a lot of beds out there right now, or pads out there, or lamps and all this type of stuff that just don't have as much power. They might be somewhat decent for the skin, but they're not going to penetrate deep and have the long lasting effects that we want from a high powered bed. So you need to make sure you go to one that actually has the research on it to be effective, that's high powered, like it has like 15,000 LEDs, 3,000 megawatts. And there's only a couple in the United States that I trust. There's two. One's called Trifecta 50. That's what I have in my office. And there's also one called the Novathor. And that one's really great too. So those two I know are high powered and going to have the therapeutic effects I'm talking about. Yeah, if you're interested in receiving help from me regarding your blood sugar, visit my website, integrativemedica.com. Find my phone number there. Give my phone number a call, talk to my receptionist. They'll set up an appointment with you, or you can set up an appointment directly from my website. I put an article that actually digs deeper in these treatments that we just talked about in the description box below. So if you want to geek out on that, go ahead. And if you want to learn more about diabetes and other metabolic diseases, click my videos to the right. I'm Dr. Jake, and I'll see you there.